here with Dr. Thomas Kotoske at Body by Kotoske, and we're going to talk now about breast augmentation, probably one of the more common plastic procedures, right?
Absolutely. In fact, one of the biggest parts of our practice, and we have a huge population of patients that we treat. The key for that process is listening to the patient, understanding what they're trying to achieve, and then giving realistic information in terms of what they can actually achieve. So what we do is we go through a process of measurements, and then we talk about the different options. We have many different types of profiles of implants today, whether we're using a cohesive gel, a silicone gel, or a saline implant. They all have different types of contours and projections to them. So we can take that information to achieve the appropriate lift of the breast, the lift of the nipple tissue, the projection, the shape. And a lot of that I garner from the discussion with the patient. We go through photos to determine what they're looking for, but then we look at these implants and I can basically tell them this is what will work.
Okay, now let's talk about something, those implants.
Yes.
Are they safe? How does this work now? I'm sure, how have they changed? Because there's been a lot in the news media about that.
Absolutely. So, it is one of those things that there's been a lot of coverage on, and what has come out is that the textured silicone implant has given rise to an association with a particular type of cancer that is found in the capsular tissue adjacent to these implants. We don't see that with smooth-walled implants, but we see it with the textured implant. And so what happens is these patients will develop an inflammatory process. They'll develop a collection of fluid, the skin changes, it becomes sort of dimpled, rash, all of that. Those are things that we start to see that would indicate you need to go in and see your physician to get an MRI done, to take that capsular tissue out, remove the implants, and let's get some diagnostic material so we could look at. In general though, implants are very safe. The type of implant that we use, the smooth wall implant, has never had any association with that. So what I would say to patients, if you're experiencing difficulty, collections of fluid, redness, dimpling of the skin, pain, firmness, you need to see your physician. Those types of things need to be evaluated to determine if there's any association with that.
And there's also a procedure without breast implants, correct?
Absolutely. So we do breast lifts, or what's called a mastopexy. And what that is we can take the nipple tissue that may be very low or excessive or lax tissue, remove it, and take that skin envelope with your tissue and bring it up into a very beautiful position. Typically requires a keyhole incision around the nipple, vertical cut, little cut across the base of the breast. But the way that we do this, we do it in multiple different layers. There's really no stitches to be removed typically. It's all done internally, a little paper tape dressing that goes across. A lot of suturing that's done to get these to sit in a perfect position, because a lot of times women will come in with asymmetry, one being bigger than the other or one tailing off. We will correct that at the time of that breast lift. I also do a particular type of lift where if women have had implants and we need to create a smaller pocket, we can do it internally with no cuts on the external portion of the breast, except where the implant was placed. We would replace with a much smaller implant, but we can raise the tissue up. It's called a capsulorrhaphy procedure, where we actually decrease the whole width of that breast cavity and bring the nipple tissue up. So those are two procedures we do very frequently they're beautiful. They get fantastic results with.
Wonderful. So there's a lot of options.
It's a lot of options. And we gain all that at the time we do our history and physical with our appropriate measurements.
Okay. Thank you.
Okay.